Welcome back to Healthwise. With us today, our very special guest, Dr. Kevin Guillory at Opelousas Family Clinic. Doc, we were talking about, well, we hadn't started, but we're going to talk about diabetes. First of all, for our audience, tell us, what is diabetes?
What diabetes is basically uncontrollable sugars. A lot of us, we like to eat sweets. This is Southwest Louisiana. But what can happen sometimes is our bodies, for people with diabetes, their bodies are unable to handle the sugar. They are not able to deal with the sugar amounts in the way normal people do. Our body normally makes something called insulin, and that helps keep the sugars under control. For some reason or another, people with diabetes, their insulin, either they're not producing enough or the body is not responding to the insulin, and therefore the sugars get out of control, and that can lead to complications and diabetes.
Okay, and would that be because of the pancreas? Is not, I mean...
The pancreas does produce insulin, okay. And so that's where we get it. But what can happen sometimes is there's different types of diabetes. There's type 1 and type 2. People with type 1, their pancreas for some reason or another does not make the insulin. And so they have to actually take insulin for it to get under control. For people with type 2, whether it be genetics or lifestyle, their body may make the insulin, but the pancreas may make the insulin, but the body doesn't respond to it in the way that it should. And at a certain point, if the disease gets extensive enough, the pancreas cannot make the insulin that it's supposed to, so they may actually end up needing insulin, meaning type 2 diabetics.
Okay, so basically type 1 is, that's usually the people that need the injections, right?
Correct.
Okay.
They usually need the injections. Those are people that usually actually are born with the disease, and we usually diagnose them in childhood. So they have usually a lifetime of taking the insulin because their body's not making it. Now, type 2, they usually start with oral medications, depending on where they're at in their disease, but at some point, they may end up needing injections, the insulin injections. It just depends on how far the disease progresses.
Okay. I mean, I know in today's lifestyle, like you said, there was an old wives' tale. People used to, and I'm sure your parents told you too, living in the church. You know, you used to always say, if you eat that too much sugar, you're gonna get diabetes. Okay, let's talk about that.
That is a myth. It's not really just eating sugar. I mean, eating sugar can lead to other things. I mean, it can lead to being obese, but it's the whole lifestyle, and it's not just lifestyle. There are many risk factors for diabetes. One of them is your lifestyle and your diet, but a lot of it is age, ethnicity. A lot of it is in African Americans and Hispanics. Family history is a real strong indicator, and obesity is a real risk factor. But family history really is a very strong risk factor. So it does run in the genes. So people, and I stress to my patients who have parents or close relatives with diabetes in their family, just to get checked.
Okay. Also, you hear some pregnant women all of a sudden will say, well, I've got diabetes. What is that? That's
gestational diabetes, another type of diabetes, and some pregnant women can be more prone to it just because they are carrying a heavier load, and sometimes just the different mechanisms of pregnancy can lead to uncontrollable sugars, at which point, you know, they can be started on medicine or they just do diet control. Gestational diabetes normally ends once they have the baby, maybe 2 or 3 months afterwards. That it may linger, and sometimes it may linger even longer, and they end up with type 2 diabetes. But usually that runs its course once the baby is born.
Okay, so it's not, it doesn't last. It's
usually doesn't last.
You know, I'm sure in some case everybody's different, so maybe you have some that do, but maybe they had it in their genetics all along, so they were prone to get diabetes eventually anyway. So, well, let's talk about some of the symptoms. How do you know you have diabetes?
A lot of times, and that's the problem with diabetes, a lot of times you don't know. It's called the silent killer. But some things that you can look for, other than knowing that you have a family history, or going to the bathroom more often, going to the bathroom a lot during the day. And I just don't mean 2 or 3 times, but going like every hour or just more often than you're used to. Being thirsty a lot during the day can also be a sign. A lot of times you can have the numbness or tingling sensation in the fingers or toes, and that can be a sign of diabetes. A lot of times you just have a sense of fatigue, that you're just not feeling well. You're more exhausted during the day, and that's not how you normally feel. And sometimes you can have weight loss, and I see that a lot in people who come to me complaining of weight loss and fatigue, and we end up checking their sugars, and they end up being in the 300 range, which is very high. So a lot of that is signals as to early signs of diabetes.
Right, and you know, I noticed you said that it's a silent killer, and you might not know, but in someone, let's say, well, first of all, let's talk about what's the normal range for...
Normal range for sugars. It now depends if it's fasting or if it's random. By random, I mean you're not fasting and you can check the sugar at any point. But if you're fasting, usually greater than 126 means you're diabetic. Now, there is borderline diabetes. Usually we like to say greater than 100, between 100 and 126 usually is borderline diabetics. But normally, and that's for fasting, but normally fasting, greater than 126, we like to say that's diabetic range. Now, if you're not fasting, then usually greater than 200. If you've had something to eat and we check it, like that's a random glucose check, that if it's greater than 200, that normally means it's diabetes.
Okay, all right. Because I know on the unit, on the ambulance, a lot of times, you know, we'll go and check somebody's blood sugar, and a lot of times 120, 130, we like, cool, you're all right, you know, you're fine, everything is fine. Well, and what about in the high range? I mean, okay, if someone is, you know, is diabetic, what should they look for as far as their, I guess, mental aspect?
As far as mental aspect? Right. I mean, a lot of things that can happen is, as I said before, just feeling very exhausted, maybe not being as alert as you normally are. A lot of times they have the numbness and tingling, like I said, which, you know, is not normal. So some things like that. And a lot of times you can, if it's bad enough, you can get like the blurry vision in the eyes. We like to do eye checks in diabetics, which I'm sure we'll hit on later, but a lot of times blurry vision, and along with all the other symptoms we talk about, can be a signal of diabetes. Okay.
All right. Well, Doc, after we take a brief break for our sponsors, we'll come back and we'll talk some more about diabetes.